So we have discussed this early relapse score in our previous interviews, and now finally our EBMT early relapse score has been published in the Journal of Bone Marrow Transplantation, and we claim that this novel score discriminates the early relapse risk within the first 12 months from the transplant better than the previous scores that have been published. And it's a very simple score. It utilizes ISS, which is a disease-based marker, and patient's performance status prior to transplant, which is again patient-related factor. And the third one is a treatment-related factor, which is response prior to transplant. So the three main components of anything which defines the way the disease, the patient, and the treatment is combined in a score. This gives us an estimate of a relapse risk ranging between 50 to the less than 5%. So it has a capacity to differentiate about 50% who will not relapse, but 50% who may relapse, who have the high risk score. This may be useful for prediction ahead of time before clinical relapse occurs, and the discussion we had earlier to have intensified post-transplant treatment, or maybe even more intensive immunotherapies to prevent progression in the subcategory of patients. But of course, this score needs to be validated, and our efforts are ongoing to encourage other groups to validate within their databases the scores impact in their own patient profile.